Part of the AS Anatomy and Physiology syllabus, students need to know about the cardiac cycle. They need to be able to describe the link between the cardiac cycle and the conduction system. So I'm now going to talk you through the cardiac cycle. The cardiac cycle represents the mechanical event of one heartbeat. At rest, one complete cycle lasts 0.8 seconds and is repeated approximately 72 times a minute. The cardiac cycle consists of two phases, the contraction phase and the relaxation phase. These two phases are called distole and systole, and sometimes in human biology it's called dystole and systole. The distole phase, lasting 0.5 seconds, represents the relaxation phase, and systole or systole, lasting 0.3 seconds, and this represents the contraction phase. I'm now going to talk through the cardiac cycle of the heart, and in the top right hand corner here is a nice picture of the heart which is being labelled. So as I talk through some of the key areas, you'll be able to look up into the top right hand corner, see that they're labelled, and that should hopefully make it clearer when I'm talking through these three areas here. So to start off with, in the distole phase, which takes 0.5 seconds, both atria fill with blood. So both of these two here fill up with blood, and the AV valves are closed. So these valves here, which are shown here, should be closed. From there, the atrial blood pressure rises above the ventricular pressure. So the blood pressure in these here will be a lot higher than here. Rising blood pressure forces the AV valves open, and blood passively passes into both ventricles. So blood will move down into this area here. Okay, the semilunar valves will be closed, and from there we can then move into the systole phase. So as you can see, the semilunar valves are here and nicely labelled here for you to look at. In the systole phase, which takes 0.3 seconds, both atria contract, actively forcing the remaining atrial blood into the ventricles, and then the semilunar valves remain closed. The next phase from here is both ventricles contract, increasing ventricular pressure. So the ventricles here will contract, and then that will build up the pressure, and from there the aortic and pulmonary valves are forced open and the AV valves are then closed. So these valves here will be forced open, and then these valves here, your AV valves, will be closed, and then we can move from there into the final phase, where blood is forced out into, and the aorta or the body tissue or the skeletal muscle, and combining those two together, that makes the stroke volume. Pulmonary arteries, the blood will also be forced out to the pulmonary arteries to the lungs as well. You've got to remember though that only 40 to 50% of blood is ejected at rest during ventricle systole. There is one final phase, which is the distole of the next cardiac cycle begins, which is called venous return, and then the whole cycle starts again. Right at the start, it said that it takes 72 beats. It takes 72 beats a minute. This is an average adult. When you think that 60 beats a minute is what's classed as bradycardia, and that's what you really hope for. Most trained athletes are 60 beats and lower. I'd like to add just one more key thing, which is really quite helpful to remember. The events during the cardiac cycle occur simultaneously. So whatever takes place on the left-hand side also takes place on the right-hand side, and this is really quite key to remember, especially as when you move into learning about the conduction system. So I think that's it. Thank you.